Hello there, my name is Victor Ogunyika, and you're welcome to the midweek edition of Today in the News, and of course, all of those newspapers across the Federation, and looking at the major headlines everywhere.
Over 1,000 people are benefiting from free medical services provided by the FCT chapter.
Some of the Arsenal fans will be very interested in this news. Arsenal smash club transfer record signed Pep.
Hello and good morning, and of course it's a rainy day on a Tuesday, and this is Vanguard Live, and this is definitely Today in the News, where we read and also analyze the top stories on the front pages of the newspaper. My name is Precious Chukudi. I'll be going ahead with the dailies, and I have Vanguard in front of me, and major headlines. We have raging coronavirus. Let's lock down now, says Aisha Buhari. Nigeria records first COVID-19 death, confirms 40. Fears as a Bauchi governor rather goes into self-isolation. Article Son didn't attend Southwest PDP rally or young government. All land borders shut. FEC meetings suspended indefinitely. Private operators, non-essential staff should stay home for 2 weeks. NECA. You can see that story on page 3. And on page 3 as well, you have Ebonyi government bans burials, weddings. And also on page 4, we have presidency to Lawan and Baja. Subject members back from overseas trip to screening now. And on page 22, how insufficient facilities can ruin Nigerians' containment effort. On page 12, we have weekend shots, park, nightclubs, and cinemas. On page 4, we have COVID-19. CJN orders court to shut down from today. MPA Shippers Council on lockdown on page 11. And on page 4 still, we have prepare for tougher measures. Lai Mohammed. And on page 15, we have Christian Council of Nigeria says no to public gathering. And from Vanguard, we move straight to the Punch. And on the Punch newspaper, we have major story, contact. We may be heading the way of China, Italy, federal government wants. Cases rise to 40. Government orders complete border closure. We will deploy soldiers to enforce contact tracing. Federal government. Former PPMC MD, first Nigerian to die of coronavirus. Nigeria has less than 500 ventilators for patients. And from the Punch, we move straight to the Nation. And Nation major headlines, they have Nigeria's near lockdown as COVID-19 spreads. And we have Kaduna, Kogi, Ogun, Osun, Ondo, Rivers send workers home. Niger imposes curfew. Troops likely for enforcement as government goes tough. Land borders shut. FEC councils of state meetings put off. Bauchi governor goes into isolation. Buhari to Abuja Lagos residents stay indoor. And that's all we have for you in the papers today. So we'll move straight to our newspaper analysis segment, but we're going to go on a short break. When we come back, we'll introduce our guest in the studio who will be talking the whole COVID-19 circulation with us. We'll be right back.
If you are a parent, chances are you're worried and have questions about just how contagious coronavirus is and whether your child could be at risk. Misinformation has cropped up across the internet since coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF's health experts to get us the facts. Here are 6 things they think you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people who are coughing, sneezing, and have a fever. Symptoms of coronavirus can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal, but that's mainly among older people with pre-existing conditions. Wash your hands frequently for at least 20 seconds using soap and water or an alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. Use your elbow, like this, or use a tissue and then throw it in the bin immediately after. Not really. If you don't have any symptoms, there is no need to wear a mask. Hand washing is actually more important. If you're coughing or sneezing, it's advised that you wear a medical mask to help protect others. For now, there isn't enough evidence to support whether the virus is transmitted from a mother to her baby during pregnancy or what impact this might have on the baby. To date, there is no specific medicine to prevent or treat the new coronavirus. So the best thing you can do is practice basic hygiene. To learn more, follow UNICEF and the World Health Organization for the latest updates. And if you found this video helpful, pass it along to your family and friends.
Welcome back. If you're just joining us, it's still today in the news. We just finished with the newspaper review, and we're moving on to the newspaper analysis segment. And I won't be doing this alone. I have a guest in the studio, and he's a medical practitioner. He's the person of Dr. Yusuf Olawale. You're welcome, Dr. Yusuf. It's good to have you here. So we're talking coronavirus now. That seems to be a topic for almost every day now, considering the fact that we have increase of cases. You know, yesterday we had like 36, and still that same yesterday it rose to 40. You know, it's like we don't even know what it's going to increase to today again. And what can you say is the result of, you know, the increase in these cases?
Good morning, everyone. Because people are still coming into the country, obviously we will still see increased number of cases. And also, another reason is the fact that people are not adhering to the precautions that were given out by the Center for Disease Control and the government. And you know, in our nature, some still don't believe that there's something called COVID-19 and all that. So there's laxity across all sectors. So I think that's why, and because also our populous nature, we are very much in this country, so we are still likely to see high number of cases.
All right, so do you basically think that because there's this whole stay-at-home policy, stay at home, but we don't have enough, like the average Nigerian probably would have like 5 to 6 people staying in the same house, and you know the whole stay-at-home policy is basically for you to like self-isolate yourself so you don't get in contact with other people, and you know those kind of, do we have what it takes to especially considering the country we're from?
I would like to look at that in 2 ways. First of all, the people that were told to self-isolate the people that were coming from the high-risk countries
Okay.
where community transmission had been detected. So the essence of the self-isolation is to see, because the incubation period is an average of 14 days. So within that period, if you develop symptoms, if your symptom gets worse, you can call the Center for Disease Control.
But are those people not also risking the life? For example, if I came into the country and where I stay is like, let's say, a 2-room apartment, and I traveled in and from one of the high-risk countries, and I'm supposed to stay with my family, I'll stay at home. Am I not going to, am I not at risk of, infecting other people around me? Because I feel like when these people come into the country, they're not supposed to even go to their family. They're supposed to be, isolated somewhere away from their family, because you don't know if you have it.
Okay. The country that can do, I personally have not seen any country that really isolates everyone at the airport, because it's cost effective. The transmission may even be higher if you don't have a facility big enough to accommodate all those people coming in. It's going to be a problem. But if someone is going home, you yourself, you owe it to yourself and to your family members. Let's say, for example, you have a 2-room apartment. Everybody automatically has to move to one. You have to be in the other room and try to check yourself so that at least you prevent the spread if you have it. Because there are even things now that stop the asymptomatic transfer. That's still being looked up to. So you may not even know that you have it, and you're already spreading it. And you as a youth, you may not even come down with the worst symptoms or even die of it, but you may serve as a source of transfer to an elderly person.
Okay. So we currently have only 5 designated coronavirus laboratories to cater for like 200 million people. Like, how is this possible? Having just 5 coronavirus laboratories in the country, and they're not even closed. So it's like, when, like, before this state will be able to access to one in case of emergencies, like, how does this even work for us here?
Well, 5 definitely is not enough, but it's still something, because I know of some other countries that they still have 1. And throughout the press briefings of the minister that I've seen, people have also come up with the question. And he said that at times it's not the number of labs that you have, it's the turnover of the results that you get from it. Meaning that if you have like 10 samples to run, and if you can get them done in a day, so it doesn't really necessarily mean that you have to spread them all over. If one lab can get you the results of like 50 or more in a day. So, but he also said something like, apart from the 5 that we have, because I think they are concentrated in Lagos, Osun, Edo, 2 in Lagos, 1 in Osun State, 1 in Edo. Yes, that's 4. I can't remember the last one. Then he said we are expecting another machine. So I think that one will cover for. 1 is also in Abuja. So I think one should also cover the northwest, northeastern part of the country. So I think they said they were still expecting another machine.
Okay, on the isolation centers, there are reports that Lagos State only has, it's only Lagos State that has a functional isolation center, and no other state has.
For that, apart from the federal government, we also have to keep our state governments in check. Lagos, yes, we've been seeing press briefings from the committee. In fact, I'm very sure that there are some states that they don't even have any task force yet. And this isolation center are not supposed to be something big or something that you just need to design with gold or something. What you just need there is that you should just arrange the beds in a way, even if you don't use it for COVID-19, you can use it for Lassa fever. If the Lassa fever scourge passes on, other communicable diseases like TB and all that, you just have a place to keep, so that those ones won't be spreading it to other people outside. So it's not even supposed to be something extraordinary, but our politicians, they are not just taking it serious. That's just what I have, except for some very few. That's just what I think.
Okay, so we had two cases that were free. That's the Italian man and also the lady who returned from the UK. That they declared coronavirus free. Now, one of the things that we've not been we don't have information on is the fact that we don't know what sort of treatment these people were given to make them free, because before you say these people are coronavirus free, that means they have gone through some levels of treatment, but we're not getting that like information on that, like, okay, this is what they did, this is the processes. Don't you think we need to know about things like that?
Um, if if I say I've not seen any of the treatment protocol, I will be lying. I've seen it, but I think the NCDC and other people have to partner with them more and also see the kind of things they will see. So what they usually do is that right now they do not have a definite cure for it. So it's it's a virus. They have antiviral medication. Elsewhere, some have said things about chloroquine, hydroxychloroquine,
But
and
that
all that.
chloroquine itself, there are reports that some families, they died as a result of, because they felt like, okay, let's take this chloroquine and then solve our problems ourselves, even though they are not even sure if they have it yet or not.
Yes, so that's why you have to follow a guideline and you don't have to treat yourself. The chloroquine example, it was given by a president of I think United States or so, and they've not the protocol that we have. I'm not sure we've taken it even from there. The health experts there also have not really said 100% this is the cure. It's still going to undergo trials and all that. So right now, more of what they are doing is symptomatic. So if someone is complaining of chest pain, they manage that. Breathing difficulty, they need oxygen, they do that. They give antiviral medication and all that. So and what the things that they usually do before they declare someone free, after the treatment, they will have to run two different tests. I think about 48 hours or 24 hours apart. So if both of them are negative concurrently, it means the person has cleared the virus and the person can go home.
Okay, so this coronavirus in itself, I heard that people who have like maybe medical conditions might not be able to survive it really, because considering the deaths that we just had, the one death we recorded, and it was said in the papers that he had medical conditions before. What do you suggest and what do you advise people who have some certain level of medical conditions?
For people, for the case that died, the medical conditions that he had, I think they mentioned like two, and those were very, very high conditions, high mortality conditions that even without COVID-19 can even kill someone. In fact, we learned that they went for chemotherapy abroad because one of them is related to cancer-like condition. So for someone that has a medical condition that deals with immunity, you are the person that has to take the social distancing more serious. You don't have to go out, you have to treat yourself for the medical condition. Then also, I've heard of instances whereby some do not even know that they had pre-existing medical conditions. It was during the illness through the COVID-19 where they ran other tests. That's when they now. So that's why whether you even have the medical condition or not, take the precautions, eat well, take the social distancing serious. Don't travel if you don't need it. So just take everything serious. Do the hygiene very well.
All right. Okay. So thank you, Dr. Yusuf Olawale, for your time and all that. So we're going to go on a very short break. When we come back, we'll introduce another guest as well, who will also be talking about the economic situation of coronavirus in our country. We'll be right back.
We are working with the Ministry of Health on protecting our citizens from COVID-19 virus. As a government, this is now a key priority for us. I therefore enjoin you to ensure that adequate medical provisions and other welfare requirements are afforded
If you are a parent, chances are you're worried and have questions about just how contagious coronavirus is and whether your child could be at risk. Misinformation has cropped up across the internet since coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF's health experts to get us the facts. Here are 6 things they think you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people who are coughing, sneezing, and have a fever.
All right, welcome back. And of course, we just finished talking with Dr. Yusuf Olawale. He was telling us the medical aspects of what the coronavirus entails. And now we're moving straight to the economic, aspects. We're going to be hearing more from Mr. Jayo Akintobi. He's the publisher of Ilupeju Today. You're welcome, sir.
Always a pleasure to be here.
Yeah. Okay, so we're just going to go straight into the matter of today. And, the whole COVID-19, when it started, everyone was like, okay, we're going to be able to, deal with it, and it's not going to be something so serious. But now, having like 40 cases, it's, bringing a lot of fear in the minds of the people on social media, considering the fact that even, the president's daughter even came back and, she's, observing the whole self-isolation thing, and Bauchi governor has it now. He's observing the self-isolation thing as well. And Atiku's son has tested positive to it as well. So there's a lot of, heightening fear among the people. What do you think can actually be done about this whole situation?
Without a doubt, we are in a crisis situation at the moment. Anybody who at this point in time is still believing that this is just a passing minor inconvenience needs to become aware and alert very quickly. This is a major problem that is probably the greatest health crisis in history, and has the potential to have the greatest impact on the way we have lived up to date. I think that where we are now, it's going to get a lot worse before it gets better, without actually trying to scare anybody. But from an economic standpoint, you can already see how things are starting to change. Companies are closing, people are being asked to work from home, we're in a partial lockdown. Oil prices are down. Primarily, they were already on a downward spiral even before this outbreak, but this has even exacerbated that situation more. So without a doubt, we're in a bit of serious trouble here now.
Okay, so last week or so in the papers we read that 22,000 jobs will be lost after the coronavirus. Like, what exactly would make it, what's going to bring about this whole indication process for people to lose, like, their jobs, as well as, all these things?
Well, because when companies are not able to function, there are many companies now that can't operate remotely. They're not in the type of business where they can say work from home. There are those who trade on a daily basis. There are companies that can only operate on a physical level. So if those companies are operating below optimum level, or they've closed down completely, they can't pay salaries. When salaries are not paid, workers cannot survive, and the economy begins a downward spiral. So we can already see a couple of weeks ago there were runs on the supermarkets when everybody was trying to stock up for a potential lockdown. Now many of those supermarkets cannot resupply because the places they buy from can't get goods in from the ports. So there's a domino effect starting all the way from the companies all the way down to the common man. Even the person who works on a daily basis for daily pay, your artisans, your vulcanizers, your market women, there's a downward domino effect that's affecting all of them in terms of the income that they generate on a daily basis.
All right, so the federal government is also telling us that we need to prepare for like tougher measures, and considering the fact that in this country we don't even have what it takes to containerize these whole tougher measures. People they're telling us stay at home, but but it's even harder because we don't have what to eat. You know, the small amount of money that other people have. Like I was seeing the other time on social media where somebody said, "Oh, I bought something and I finished it already. I don't know what's going to happen to me in a couple of weeks if tougher measures are being put in place." So, what do you think about all this?
Well, the federal government has been debating some interventions to cushion the effects on people. First one we saw was the reduction in the price of fuel a couple of weeks ago by about 20 naira. That's an initial intervention that's meant to ease things for people, because theoretically, if the price of fuel goes down, cost of transportation should reduce. So it should lessen the burden on people. Also, I'm sure the federal government is looking at ways of creating stimulus packages, that is social welfare packages for people, bailouts for companies, economic stimulus that gives a shot in the arm to the economy that helps us all to, that sees us through these difficult times.
All right, so, and all of a sudden, people start to talk about social distancing. You need to distance yourself from this person, that person, and all of that. But we already know that the kind of society that we operate is really hard. Like, you go to people's houses, you see a family of more than like 7 persons in one room apartment. How does this even work? Considering the fact that some of these people might have been exposed, and since the virus is something that is just in the air, you don't know where you'd have caught it from, and you're supposed to like isolate yourself in a way, and prevent be clean and all this kind of thing. How does this really work with the average Nigerian?
That's what they're saying. Self-isolation is key. For example, if 7 people are in one small apartment together, even if one of them is exposed, maximum he can infect only the 7 people who are immediately around him, as long as those 7 people don't go and mix with other people. So we can kill it within that immediate environment, as long as we obey the rules of self-isolation, which our people are having difficulty with. Look at, it's inconvenient without a doubt, but there has to be sacrifices made. Look, for example, in the studio here today. Normally we have 3 seats, we have 3 hosts. But to abide by the protocols, you've had to restructure the studio today to where you and I are maintaining a healthy social distance. It's inconvenient for the broadcasting process, but it's a sacrifice we've had to make to keep ourselves safe. So on a larger level, our people all have to begin practicing that, because the moment we can isolate, you can keep it restricted, whether you're exposed or not. It doesn't have to go beyond this room. So that's why ultimately, even though we're on a partial lockdown now, I believe that down the road we will see a full lockdown. Some countries are already implementing it. South Africa yesterday went on practically 100% lockdown. UK passed some measures last night that is about a 95% lockdown. I think ultimately, to kill this thing completely at the source, everybody needs to stay away from everybody else for now.
All right, so do you think that the media is doing enough in terms of sensitizing the public? Because some people don't even know that there's something we call coronavirus. They have no idea about it.
I was completely shocked last week, I think Wednesday or Thursday, a handyman who works around our facility, who lives in the suburbs of Lagos, came down to come and fix something, and I was discussing with him, and to my horror, I discovered he wasn't even aware that there was any such thing as any illness, any virus, any contagion, as of just 5 days ago, despite the fact that people were already catching it and people were dying from it and all kinds of things. He doesn't even know. And what's even scarier is that he told me that nobody in his community, which is in Lagos, is even aware that any such thing exists. So that is a scary place for me to be, because it tells me that sensitization is not deep. For now, if you look at the people who've caught this, they're mostly elites, really. I mean, who can afford to travel and come back from a foreign country? And the elite, when they come, they're around their family. So if you look at the categories of people who've been infected so far, they're elites. But guess what? That elite has a driver, has a house help, has a security guard that's exposed to him, that will catch it from him and take it to his family. So I think the government, not necessarily the media, I think the government needs to deepen its sensitization mechanisms. I think they need to engage community media a lot more, because they talk directly to the grassroots. I think outside of the cities and the conurbations and the cosmopolitan areas, I don't think enlightenment is deep enough in the suburbs. And those are the people who really need to be sensitized, because they're the ones who don't really, that's where there's high density in the housing. That's where transportation, people are packed like sardines inside a small bus. That's where there's no concept whatsoever of social distancing or of hand sanitization or washing hands. Where the epidemic can really become rampant are the places where the information is not known today of how to prevent its spread.
Okay, so thank you very much, sir, for all your information. But I would like to ask you, what are your own personal hygiene towards the whole coronavirus thing?
Well, even before coronavirus came, I was always a compulsive hand washer anyway. So I wash my hands quite frequently. I worry a bit about this notion of hand sanitizer being a preventative, because most alcohol-based hand sanitizers are bacterial in nature, and we're dealing with a virus. So I think hand sanitizer, while it's good, it keeps your hands clean, it's not necessarily a preventative per se, but it's better to use it than not to use it. I also think there's a bit of a misconception about the face masks, in terms of you see people walking on the street with face masks on. They're only effective for a few minutes, and really they don't really prevent anything per se like that. So on my own, I practice social distancing quite well. We've shut down our office. I'm working from home so as to limit exposure to other people. And I think these are all basic measures that we should all practice.
All right, so thank you, Mr. Dayo Akintobi, for sharing all of that with us. And remember that you can equally like, share, and subscribe on all our social media platforms showing on your screen. Prevention is better than cure. Social distancing, like you rightly heard, wash your hands properly, well, with running water. Ensure that you are not, in a clogged place, because you don't know who has it or who has come in contact with someone who has it. So you just need to prevent and protect yourself, which is really important. This is where we draw the curtains for today in the news. Till I come your way next time tomorrow. Stay clean, stay hydrated, and keep the social distance.
We are working with the Ministry of Health on protecting our citizens from COVID-19 virus. As a government, this is now a key priority for us. I therefore enjoin you to ensure that adequate medical provisions and other welfare requirements are afforded